Hi there, my name is Aurora, and I'm an occupational therapist here at North York General Hospital. I'll probably see you the first or second day after your knee and hip replacement. And my role with you is just to see how you're doing functionally. That means things like getting dressed, getting in and out of the bathtub, those kinds of functional, practical things after your surgery. I'm also going to talk to you about what equipment you need to make sure that you're safe following your surgery. So if you turn to the section where it talks about equipment and devices vendors, there you can then figure out which equipment vendor you want to choose to get your equipment from. It is your responsibility to get your own equipment. You just have to decide if you want to rent it or buy it. Typically, if you are having a knee replacement, we recommend that you have equipment for about a month. It's really up to you again if you want to buy it or rent it. And for those that may have medical insurance coverage, extra health benefits, you can always call your insurer before you come in and ask them what your policy is. Then you can determine if you want to rent or buy the equipment. So first piece of equipment that I brought in here is a raised toilet seat. The purpose of this is to make life a lot easier as you're getting up and down the toilet. By making your toilet higher and taller, you don't have to bend down so low. So it'll be less painful on your knees, less painful on your hips, and you're less likely to fall. Now this one's pretty standard. This one's about 4 inches. They do range between 2 to 5 inches. It all depends on your height, which you prefer to get, but most people are okay with the 4 inches. I'm only 5'2", so for myself, I would get something that's about 2 inches because I don't want to be too high above the toilet. So this is appropriate for most people, okay? This one here also has arms. So it all depends on your toilet and where it is in the bathroom if you would need one with arms. If you have a counter beside you that you can use for support, you won't need a toilet seat with arms. Okay, so this is fairly easy to install. This is my standard toilet. I would lift up my toilet seat, put the toilet raised toilet seat on top, and then just tighten the bolt here, and voila. Automatically my toilet's much higher for me, much easier for me to use. So here I am backing up to my toilet seat. I'm gonna reach back for the arms or whatever counter support I have here and have a seat. Much higher, much safer, okay? After 1 to 2 months, when I'm much stronger, getting around much easier, I remove this and just go back to using my regular toilet. If you have a shower stall at home, it's much easier for you to get in and out because you just have a small step to deal with. It depends on the size of your shower stall whether or not you need extra support. If it's fairly small, you can touch all 4 walls, you should be able to manage without any equipment. If, however, it's a little bit larger and you want more support, something like grab bars could give you the extra support you need, or an extra bath chair. Pretty straightforward getting in the shower stall. And then you're typically going to back in, either use the arms for support, getting in. If you want a longer shower, you can sit down in the chair. So after knee replacement, you may need one of 2 pieces of equipment. It all depends on how you're progressing and how well you're doing. So option 1, let's say you're doing very well after your replacement. Let's say you're bending your knee 90 degrees, you don't have too much pain, you don't have too much swelling, you're able to step into the bathtub just like this. If you're able to do that, then you'll be able to sit comfortably in the bath chair and have a seat for your shower, okay? And then coming out on your own. That's option 1. If, however, you're having a little bit more pain, you have a little bit more swelling, you're not bending as well, or if you're getting 2 knees done at one time, then I would be recommending for you a bath transfer bench. What I brought in here is a reacher, very, very helpful. Just an extension of your arm. If something drops on the floor, you can bend down. You can use the reacher to pick it up from the ground, okay? This reacher can also help you with getting dressed, putting on your pants and putting on your underwear. So you then put your pants on your lap, okay? Grab your handy reacher, and you're just gonna pinch the middle of your waistband. You can't bend down to reach your feet, so at least then you drop the pants down to your foot. And then once you can reach with this hand, you let go of the reacher, and there you are. Once the operator's leg is dressed, this one here you can easily bend and twist. Get into your pants, okay? Once both legs are in the pants, that's when you then stand up and pull up your pants, okay? You're being safe the whole entire time. Time to take them off. You're gonna push it off with the reacher as far as you can, all the way down. You can then pick this up off from the ground. Another great tool that I brought in here is a sock aid, and this will help you put on your socks. I've got my sock and I've got my sock aid. I take the sock aid, okay, put the sock on the sock aid, wiggle it through, all the way through. Here's the toe, here's the heel. Again, sitting on my chair, sitting on my bed, put the sock aid on the floor, okay? Wiggle my operated foot in. And once it's there, I then pull the strings. And voila, okay? You can then use the reacher to straighten out your sock. You can use the reacher to also take your sock off. Another great tool that I brought in here, a shoe horn. So please be mindful of the shoes that you're wearing to the hospital, that you bring to the hospital. Make sure they're a little bit looser, whether it be runners or whether it be sandals. Make sure you're nice strap behind the heel to help you support. And there you are. Another important room in the house that you want to think about is your kitchen. With your kitchen, you want to plan ahead before you come in for the surgery. Perhaps put commonly used items on the countertop. After surgery, it's going to be hard for you to bend down and reach for things. So it's good to lay things out before you come in, so at least it's easy for you to reach for things after surgery. Okay? You can get pots and pans, putting dishes out, your commonly used items, so they're easier for you to grab. Prepare ahead of time so people can help you afterwards your surgery.